All right, let's dive in. Today, we're looking at materials from a company called LifeActive Bio. They're proposing a new delivery technology that could fundamentally change how we approach metabolic health. And it all happens right through the skin. Let's take a look at what they have to say.
So why does a technology like this even need to exist? Well, it all starts with this one absolutely massive number. $3.2 trillion. That's the estimated size of the market just for treating metabolic diseases. It's almost hard to wrap your head around a number that big.
But here's the thing. That's not just some number on a spreadsheet for investors. It's really a way to measure a truly staggering global health problem, one that affects millions upon millions of people every single day.
And to really bring home the human cost of this, their materials highlight a pretty stark comparison from the World Obesity Atlas. The number of people dying prematurely from this crisis is now higher than from traffic accidents. That really puts the urgency for new solutions into perspective, doesn't it?
And the sheer scale. I mean, it's just mind-boggling when you look at the numbers. We're not talking about a small issue here. This is a full-blown global epidemic. You've got 590 million adults with diabetes, nearly 1.3 billion with hypertension, and 2.5 billion people who are overweight. It's everywhere.
Okay, so you've got this massive problem, right? Affecting literally billions of people. The obvious question is, why has it been so incredibly hard to solve? Well, that brings us to a major scientific hurdle.
Well, according to LifeActive Bio, the answer lies in something they call the delivery dilemma. And it's this fundamental challenge, right? How do you get the good stuff where it needs to go inside your body and make sure it's still intact and ready to work when it gets there?
Okay, a huge piece of this puzzle is a process called first-pass metabolism. You see, when you swallow a pill, it doesn't just go straight to work. Nope. First, it has to get processed by your liver, which kind of acts like a security checkpoint, and it breaks down a huge chunk of the medication before it can even get into your bloodstream.
The materials use a really simple analogy to explain this, and I think it works perfectly. Imagine you order a package, but before it even gets put on the truck for delivery, it goes to a main sorting facility, and the workers there just throw out half of what's inside. By the time it gets to you, it's a damaged package. That's kind of what your liver does to a lot of medications. So the big question becomes, how do you get your package delivered without it going through that, destructive sorting facility? Well, you find a new route. And that's exactly what this proposed solution is all about.
And this is where LifeActive Bio's proposed answer comes in: MAP technology. They describe it as a microemulsion, basically a special carrier designed to ferry active molecules directly through your skin and into the bloodstream. The key here is that it completely bypasses the digestive system and that whole first-pass metabolism problem we just talked about.
Now, one of the key mechanisms they talk about involves nitric oxide. Apparently, it can go down two different paths in your body. There's a bad path that can lead to things like insulin resistance, and then there's the good path that promotes insulin sensitivity and better metabolic outcomes. The whole idea here is that their technology pushes your body to choose that good path.
And they're not just presenting this as a one-trick pony. It's a whole platform technology. They're talking needle-free delivery, using ingredients that are already generally recognized as safe or GRAS, but that really jump out are its potential to transport large molecules, which is a huge challenge in drug delivery, and its capacity for polypharmacy, which is just a fancy way of saying you can pack multiple active ingredients into a single application.
Okay, so the science sounds impressive, right? But the real question, the one we all have, is, does it actually work in the real world? For that, the company presents a 90-day taste study.
All right, let's look at the numbers. And this first one is a big one. A nearly 40% reduction in fat mass. And listen, that's not just weight, that's specifically fat mass, which is exactly what you want to target for improving metabolic health. And then there's this, a 404% increase in nitric oxide. No, that is not a typo, a 404% increase. A jump like that directly backs up that core scientific claim we were just talking about activating the body's beneficial nitric oxide pathway.
Plus, a 27% drop in systolic blood pressure. A change like that can literally move someone from a high-risk category right back down into a much healthier, normal range. That is a huge deal.
So here's the full table from that case study. It followed a 62-year-old male who, for context, was also taking a GLP-1 medication. That's a common type of drug for diabetes and weight loss. And you can just see the significant changes right across the board, including HA1C, which is a really important long-term measure of blood sugar control. But sometimes what doesn't happen is just as important as what does. And the company makes a point of saying that the participant reportedly experienced none of these really common, often nasty side effects like nausea or GI issues that are so often associated with other metabolic treatments.
Okay, so you've got the science, you've got a case study with some pretty eye-popping results. Now what? How do you take this technology and turn it into something much, much bigger?
Well, their vision is pretty ambitious, to say the least. They've laid out this entire roadmap to systematically replace different drug delivery methods over the next decade, starting with injections, moving to patches, and eventually even aiming to replace common oral pills.
And they're not planning on going it alone. Their business model is all about licensing this MAP technology out to other pharma and nutraceutical companies. And they've got this really clear 4-step process for how those partnerships would work, from an initial study all the way to a commercial launch.
And if you want to know where their priorities are, just look at how they plan to use their funds. A massive chunk, 75% combined, is going straight into research and development and protecting their legal and intellectual property. That tells you a lot about where their focus is.
Now, we have to include this, of course. It's the company's mandatory disclaimer. It states that these claims have not been evaluated by the FDA, which is a totally standard and really important clarification for any product operating in this health and wellness space.
So when you step back and look at the whole picture, the idea of completely bypassing the digestive system, the results from the case study, this vision for a platform that could deliver countless other molecules, it really all boils down to one huge, provocative question. Could something you just rub on your skin really, truly redefine the future of medicine?